we would like to do a large double-blind RCT on autism. We do have a group in Australia who has done 2 studies. One that's been published where they look at, it's an open label study. They don't have a sham placebo, but in these children, they noticed clinically significant changes in social behaviors, meaning they were making more eye contact, their vocabulary increased. And many of the changes that we hear from the parents and we see in the children are difficult to quantify and measure scientifically. That's been part of the challenge in terms of putting together a methodologically rigorous study that would pass with the FDA. There's no universal scale or metric that has been declared. So we were using something called the CAR score. There's also an ADOS score. There's a number of different metrics that we can use, but that's one of the first issues that we need to be able to tackle before we invest. These trials cost millions of dollars, and so to be thoughtful stewards of any kind of funding that we receive, we'd want to ensure that on the back end of such a trial, that we would have good data that would convince the scientific community that this is a both safe and effective therapeutic. So that is something we're aspiring to do, but we have some early pilot studies that are giving us some promising data.